Hi, and welcome to BladenOnline. My name is Erin Smith, and I'm bringing you our week's roundtable discussion of the opioid epidemic. This week we're talking about North Carolina House Bill number 243, the STOP Act. The STOP Act is designed to strengthen our opioid substance abuse laws. One thing this act does is it requires pharmacies and providers to register with the Controlled Substances Reporting System. This system allows physicians and pharmacies to review a patient's prescription history to see what types of medications they're taking. Also, this act requires that physician's assistants and nurse practitioners also consult with a physician before prescribing certain types of controlled substances. According to a Castlight study, the opioid crisis isn't just affecting families or the abuser, it also affects your workforce and the economy. The way opioids impact the workforce is through excessive absenteeisms. According to the Castlight study, 2 million Americans are abusing opioids. 16,000 Americans die every year from overdoses, and prescriptions for controlled substances has quadrupled between 1999 and 2010. This study also says that opioid abuse has cost the American economy $56 billion, and it costs employers $10 billion per year. Also, the Castlight study found that states who have adopted medical marijuana laws have a lower instance of opioid abuse and misuse. North Carolina House member Representative Brendan Jones voted for the bill. Brendan Jones said over the last several years there has been an ongoing opioid abuse problem across our nation. Jones said in North Carolina there are 4 of the top 25 cities in the country for opioid abuse. Those towns were Wilmington, North Carolina, Hickory, North Carolina, Fayetteville, North Carolina, and Jacksonville. Jones said this is a crisis and it's causing people to lose their lives, displacing families and wreaking havoc on many neighborhoods. Jones explained that House Bill 243 attempts to address the problem by expanding the role of the Department of Health and Human Services to detect and prevent fraud and misuse. Jones said in addition it provides a more stringent set of guidelines for physicians. For example, it requires that physicians consult with physician assistants and nurse practitioners who prescribe certain types of controlled substances. Jones also said the STOP Act is a preventative and proactive piece of legislation and is just the first step in a long process of addressing the continued threat of opioid abuse in our state. In North Carolina, 4 residents die every day from drug overdoses. And we just urge you, if you have a family member or friend or coworker who's struggling with abuse issues, to encourage them to reach out and get help. If you'd like to see more of our opioid discussions, you can go to www.BladenOnline.com.